Hi, this is Dr. R. Bhuneshwari, Associate Professor of Home Science, Sri Sharda College for Women, Salem 16. Today I am going to deal with children with developmental challenges, or we call them as exceptional children. Now we are going to see the concept and definition of exceptional children. Now, who is an exceptional child? The child who deviates from average or normal child in mental, physical or social characteristics to such an extent that he requires a modification of school practices or special services in order to develop his maximum capacity. Now, children with special needs or those who require special education and related services if they are to realize their full human potential. These children are in need of special education because they are markedly different from most children in the classroom in one or more of the following ways. They may have mental retardation, specific learning difficulties, disordered speech or language, or special gifts or talents, and those can be called as talented. Now, concepts of impairments, disabilities and handicaps. The term impairment, disability and handicap, as well as when and how it is appropriate to use each of these terms. By many, disability is broadly understood in a continuum as shown below. So what is impairment? Impairment is nothing but blindness. The disability is cannot see. They have a difficulty in seeing. And the handicap is they don't know how to read or write. The second impairment is deafness. They cannot hear or they have difficulty in hearing. And the handicap is they cannot ask for direction. The third impairment is loss of a limb. They cannot walk or they have difficulty in walking, and the handicap they face is they cannot climb the steps. Now, coming to the last impairment, mental retardation. They don't know even how to wear the clothes independently. Now, the handicap is they are dependent on others for their day-to-day activities. Impairment in general can generate a disability, which in turn can lead to a handicap. A handicap will often lead to further social and economic exclusion. The more the exclusion, the less aware and concerned the community will become of the needs of the persons with disabilities and the barriers they face. This alienation leads to a widening gap in the understanding of children with disabilities and their needs. Now, the World Health Organization, the WHO, has defined impairment, disability and handicap as the following. Impairment: any temporary or permanent loss or abnormality of a body structure or function, whether physiological or psychological. An impairment is a disturbance affecting functions that can be mental, that is memory or consciousness, or sensory, internal, that is heart and kidney, or external, the head, the trunk or the limbs. It is an abnormality of structure and or function at the organ level. At this stage, an affected individual becomes aware that he or she is unhealthy. Because of the autism, the student has trouble communicating the same way other people do. Disability. A restriction or inability to perform an activity in the manner or within the range considered normal for a human being mostly resulting from impairment. A disability is a condition or function judged to be significantly impaired relative to the usual standard of an individual or group. The term is used to refer to individual functioning, including physical impairment, sensory impairment, cognitive impairment, intellectual impairment, mental illness, and various types of chronic disease. Disability is conceptualized as being a multidimensional experience for the person involved. There may be effects on organs or body parts, and there may be effects on a person's participation in areas of life. Correspondingly, three dimensions of disability are recognized in ICF: body structure and function, activity, and participation. Handicap. This is the result of an impairment or disability that limits or prevents the fulfillment of one or several roles regarded as normal depending on age, sex, social, and cultural factors. It is a disadvantage resulting from an impairment or a disability or handicap limits or prevents the fulfillment of a role that is normal, that is depending on the age, sex, social, and cultural factors for the affected individual. Measured as such, handicaps largely reflect societal attitudes towards the people with disabilities. The student with autism has a significant handicap because the school has not provided him with an alternative communication system. Disease or disorder. Something abnormal occurs within the individual. This may be present at birth or acquired later, gives rise to changes in the structure or functioning of the body. For example, a student in your school may have a disorder known as autism that may be the result of differences in the way the brain works. Now coming to the classification of disabilities. Types of disabilities. First one is physical disabilities. This physical disabilities deals with orthopedic impairment or mobility impairment. The first one is arthritis. This arthritis can be further classified into rheumatoid arthritis and osteoarthritis. The second thing is multiple sclerosis. The third one is muscular dystrophy. The fourth one is crippling from infections like poliomyelitis, infantile paralysis, and osteomyelitis. Now the next one is congenital malformation, which results due to the abnormalities in the uterus or in the formation of the fetus, which includes absent limb, reduced limb function or limb deficiency or absence of limbs, dislocation of joints, cleft palate, club foot, etc. All these things comes under congenital malformation. The last one is traumatic crippling, that is amputation. This may be due to any accidents. Now the second category is neuromotor impairments. As the name suggests, it is concerned with the nervous system and the motor abilities of the children. Under this, we deal with cerebral palsy, spinal cord injury, and spina bifida. The next one is sensory impairment. The sensory impairment, we have two things, that is visual impairment, where the child is either it is partially blind or completely blind, and the next one is auditory or hearing impairment, where the child is partial or hard of hearing or complete deafness. Now coming to the next one, it is a cognitive or intellectual impairments or disorders of intelligence. And the first one is mental, retardation. In mental retardation, we can be divided into three categories. One is the slow learners, the severely mentally retarded, and the moderately mentally retarded. The slow learners, they can do their works by themselves, whereas in the moderately retarded, they can be trained to do their daily activities, whereas the severely mentally retarded, they require complete attention of the caretakers in their day-to-day activities. And the last one is a Down's syndrome. And the next one is neurobiological disability, ADD and ADHD. Now the last one is pervasive developmental disorders or autism spectrum disorder. Autism, Asperger's syndrome, Rett syndrome, childhood disintegrative disorder. Now coming to the next one is speech and language impairment. Four major areas in which these impairments occurs are articulation, the fluency, voice, and language. Next one is speech disorder. Speech disorders are concerned with stuttering, stammering, lisping, and esophageal voice. Now the next one is communication disorders. In communication disorders, we have three different categories. The first one is expressive language disorder. The second one is receptive language disorder. And the third one is mixed language disorders. And we have the specific learning disabilities, dyslexia, dysgraphia, dyscalculia. And the last one is severe or multiple disabilities, in which the disabilities are not just one but a combination of two or three disabilities, and sometimes they are also very severe. The next one is psychological disabilities. Psychological disability, the first one is anxiety disorder. This anxiety disorder is not only common in children, but even elderly people have this anxiety disorders. The second one is bipolar disorder. And the third one is depression. Depression not only affects the children but also the elderly person. The fourth one is obsessive compulsive disorder, otherwise we call them as OCD. And the next is phobia, acrophobia, agoraphobia, and there are many more phobias in this list. And the last one is schizophrenia. Now coming to the chronic health impairments or chronic illness which affects the children's abilities. The first one is asthma, the second one is cancer, the third one is chronic fatigue syndrome, fourth one is diabetes, that is juvenile diabetes or infantile diabetes, the fifth one is hypoglycemia, the sixth one is HIV or AIDS, whereby when the parents are affected by the immunity deficiency disorder disease, the children are also get affected. The next one is renal failure, then tuberculosis, epilepsy, cardiac conditions, cystic fibrosis. Now causes of disabilities. The major causative factors for disabilities include prenatal, that is, prenatal means before birth. It can be either genetic or chromosomal, or it can be either due to the infections in the mother. Third one is exposure to toxic substances. When the pregnant mother is exposed to toxic substances, it can cause disabilities in the children. Thyroid deficiency, which leads to mental retardation, and congenital defects in the brain. Perinatal, this includes deprivation of oxygen during birth. It is during childbirth, when the mother, when there's a prolonged labor, sometimes the children may be deprived of oxygen, and that deprivation of oxygen can also lead to abnormalities in the children. The next one is abnormal fetal presentation, difficulties during the process of labor, injury to the brain and bleeding in the brain, low birth weight babies, breathing problem, severe jaundice, and severe infection. Now the postnatal includes infections of the brain, iron deficiency. Iron deficiency is a major factor which leads to the mental retardedness, accidents and head injury, bleeding and hypoxia, metabolic disorders, hypoglycemia, PKU, malnutrition, environmental causes like lack of love, security, motivation, and discipline. Now coming to the needs of the children with disabilities. The common needs of the children with disabilities are classified into normal needs, that is medical care, immunization, play, education, etc. Now the special needs includes special services in cases where the children have any physical disformation. They need the help of a physiotherapist or early intervention therapy, and when the children are affected, have hearing difficulties, they need special aids like hearing aids and special equipments like calipers, shoes and wheelchair for the children who are severely physically handicapped. And for those children who have slow learners, special education or special attention are needed. The educational needs, we need mainstream education, remedial education, curriculum adjustments, change in the examination pattern, concessions and accommodations depending on the level of the deformities or their needs. And thank you.